Good morning, everyone. It's nice to see you all taking time out on a Saturday morning to explore more about digital privacy, digital data privacy, and cybersecurity. I'm CS Shivprasad Lad, the advisory board member of 14th Degree Azimuth India Advisory, and will be moderating today's Fireside Chat. As we all know, India's healthcare sector, as it embraces digital transformation, data protection, governance, and cybersecurity are becoming defining priorities for leadership. The Digital Personal Data Protection Act, DPDP Act, as we call it, 2023, along with the forthcoming DPDP rules, they are expected to be notified anytime soon. It's not just a tick box or just a compliance checklist. It actually sets the foundation for how patient data, consent, and accountability and data security needs to be managed in a privacy-first environment. Today's session is hosted by 14th Degree Azimuth India Advisory, a firm dedicated to guiding healthcare organizations through complex data privacy compliance journeys. With over 500 years of combined team experience, we help hospitals, diagnostic labs, insurers, pharma, and digital health platforms to build privacy-first systems through audits, data protection impact assessments, data policies, and data breach response, as well as cybersecurity frameworks to ensure both regulatory alignment as well as operational resilience. We are privileged to welcome Mr. Muralidharan Ramachandran, who is a strategic business, IT, and cybersecurity leader with over 35 years of experience, including more than 2 decades in C-suite roles. He has a profound understanding of innovative technology, the trends such as AI, machine learning, IoT, blockchain, and cybersecurity, you name it, and has successfully led projects to drive efficiency and foster sustainable growth. He is currently an IT and cybersecurity advisor for several companies and startups as a consultant and advisory board member. He is also a director with a listed company and chairs their technology and cybersecurity committee, apart from being on their other committees too. With that, it is my honor to invite Mr. Muralidharan Ramachandran to share his vision today on building cyber resilience in healthcare in the DPDP area. Welcome, Mr. Muralidharan.
Thank you very much, Mr. Shivprasad. It's a pleasure being on the show with you. I'm looking forward to it. Thank you.
Thank you, Mr. Murli. So, Mr. Muralidharan, I would like to actually break this session into 3 sections, if it's fine with you. The first one, I was going to talk about cyber threat landscape in healthcare. The second one, implementing privacy by design and security by default. And the third one, incident response and breach notification, if that's fine with you.
Absolutely fine. That's fine.
Okay, so then let me shoot the first one to you. What are the most, according to you, the common and critical threats that Indian healthcare organizations are facing today, particularly in the context of ransomware, phishing, and data breaches? And while you're going to explain to me that, can you share any real-world example, Indian or global, where a cyber attack has severely impacted a healthcare system? Over to you, Murli.
Sure. Great. I think let me start off first of all to say that healthcare is one of the most affected industries due to the cyber threats. As per the recent cyber threat report 2025, which was published by DSCI, which is the Data Security Council of India, 21.82% of all cyber attacks, and that's the highest number within all the industries, actually took place in the healthcare sector. Obviously, this already means that this is going to be one area where there's going to be a lot of focus, not just by industries, hospitals, healthcare industry and other things, but also by other stakeholders, including the regulators and government, etc., right? Because of the sensitivity around it. Now, very clearly, some of the top threats are around ransomware, as you rightly said. Now, ransomware is a major threat, right? I mean, what we are also seeing is Maze, which is one of the types of ransomware that has really been impacting a lot of healthcare companies. With what it really does is encrypts patient data, and then of course the threat actor starts demanding ransom for decrypting that data, right? So this is something which is there. So while probably as a category of threats, ransomware may not be the highest as a percentage of the overall threat landscape if you divide it. But however, the impact of this is pretty significant, right? Because it entirely cripples the operations of the industry. Because once your data is encrypted, you just cannot access it. And then, unless you have adequate controls, and I'm sure we'll talk about it in some of the later sessions, this becomes extremely critical, right? I think that's something that we really need to keep in mind. The other type of threats that is really there is around phishing and social engineering. And here, I think what I would really like to bring about is two things, right? When you really look at it, spear phishing attacks are on the rise. And when you really talk about spear phishing attacks, I think with the advent of AI and some of these modern technologies, these phishing emails and other attacks that are there look so real that people fall prey to it. And that's how basically a lot of exfiltration of information takes place. Your credentials are leaked, and that gives access to the threat actor to exfiltrating a lot of information that we need. The other area is also around the entire thing of bring your own device, right? Thanks to COVID and post that, and with, of course, the rise of consumerization of digital technologies, with everybody having their own mobiles and iPads and other things, tablet devices, etc. There's a lot of adoption of BYOD across the industry, but that brings with it its own risk, because that is something that you cannot really guarantee or assure to be secured, and that's another vulnerability. And this is a trend not only in healthcare, but we are seeing across other industries as well, where this is getting exploited significantly post-COVID, because the industry has not been able to prepare themselves for this environment, because prior to COVID, everything was physical on-premise. I think that's another thing which is there. On the data breaches side that you talked about, I think what is extremely important is obviously exfiltration of data. And I'll just probably give a couple of examples which is there. But what is more important here is data breaches primarily occur due to a lot of legacy systems that especially exist in the healthcare industry. Of course, too many wide level of ecosystem players also add to it, right? Because it's just not always the large hospital chains that is there as part of the ecosystem. As you rightly alluded in your initial remarks, you have the hospital chains, you have the, let's say, insurers, the payers, the providers. Of course, you also have small and mom shops, right? You have the diagnostics, you have the clinics, you have the private practicing doctors. Everybody is part of the ecosystem of healthcare, right? And how is it that you bring everybody together? Now, that obviously drives a lot of things with it. Maybe to sum up on this area of threats, I think one also needs to keep a track on some of the emerging and sophisticated attacks. Okay, remote access Trojans, whereby a Trojan is deployed on an end user machine or a server or whatever it is, and then the threat actor takes remote control of your particular system and exfiltrates data. That's something which is there. Another thing which is, of course, there is around the proliferance of a lot of IoT devices, medical IoT devices, right? Today, every device is connected to the internet. You also have Fitbits and other tools that are being used, which again communicates data back to your doctors and other things. You have, let's say, if you're having diabetes, you have a meter which just plugs into your, in your arm, and that keeps sending data around. Now, all these ecosystem is adding a lot of complexities, and that is something that needs to be taken care of. And last but not the least is, who we cannot forget the buzzword of the industry today, Gen AI. Gen AI obviously also means deep fakes. Today, there are a lot of deep fake videos, etc., that has been used to exfiltrate information, fool people, and exfiltrate a lot of data. I think these are some of the cyber threats that are there. Now, coming specifically on this issue of particular example, probably let me take two examples here, and let me take Indian examples that has happened in the last 1 year. I start off with one of the breaches that happened last year in August, and that was with the largest health insurer in the country, right? Star Health. Now, this is all public information. If you really look at it, what was really done in this case, the hacker called Zen basically exfiltrated about 7.24 terabytes of data containing about 31 million customer records, which contained all sorts of information, whether it is Aadhaar card, PAN numbers, mobile numbers, which are more personal contact information, to policy details, birth dates, medical records, injury photographs, etc., ECGs, etc., were all exfiltrated by this particular incident that was there. And of course, this was all being sold on dark web. This was being put up on dark web. To add to this, why I'm specifically talking, I took this example, is apart from this exfiltration of data that is there and being sold on dark web, which means it is now available to anybody at large, there was a lot of also negative publicity that happened because in this case, the CISO and the management was, I would say, perceived to be part of the hack, part of this exploitation that was there. There was allegation that the CISO actually took in, of course, there was a number claimed of about $43,000 that was paid to the CISO of this organization. So helped in exploiting that data. Now that is huge reputational damage, right, to the company which is there. I think these are some things which are there. The second one I just want to touch upon here is about Apollo hospitals, which again took place at the beginning of this year, between Jan and March, April of this year. The first incident of that happened on 9th of January, when basically there was a breach, a major security breach that happened, and a lot of data was exfiltrated, right? Of course, Apollo hospitals, we all know it's a large group, 70 hospitals, 400 plus clinics, etc., right? And then a lot of data which is there. And what was interesting to note was that there was a series of attacks that was claimed to be there right up to April of data being exfiltrated. I think that's probably, of course, again, in this case, data that was exfiltrated was all about patient records, medical records, etc., which is there, including staff data and other things as well. Now, if you look at it, all these were obviously with certain technical flaws. In the Star Health example, it was primarily a credential leakage and API vulnerability, which was exploited to get the data out. In the case of Apollo, it was SQL injection, reverse shell access, and unsecured URLs, which was exposing sensitive data, which was exploited here in this case.
So what lessons do you think, Mr. Muralidharan, can Indian hospitals and healthcare sector organizations learn from these incidents?
You see, I'm a firm believer of what I call as PPTG. And let me decode that acronym for you. PPTG here talks about people, process, technology, and encompassing this whole thing is governance. Now, I'm a hardcore technologist by profession and passion, but irrespective of this, I will still always claim that PPT is at the same order of importance. People many a times associate all these cyber issues, digital issues, security issues with technology alone, but it is basically people, process, and technology in the same order of importance, because it is people who is the most weakest link in this whole chain. So from a key learning perspective, very clearly is from a people perspective, we have to keep constantly training them, educating them on saying how do they really take care of being very, very careful in whatever that they do. Because as I said, of course, the level of attacks are getting very, very sophisticated with AI and other things. A lot of these things become so real. But one needs to keep educating your people on how do they handle this data. From a process perspective, of course, cyber, and of course now with DPDP coming out now, expected to come out anytime soon, you really need to look at it from a process perspective. How is it that you're designing security by default, privacy by design into your whole things? I'm sure we'll talk about it as we move forward. That is something that you need to take care. And from a technology perspective, obviously there are a host of controls that you need to look at. How do you protect your critical infrastructure? It's not easy, especially for hospitals or medical ecosystem players who have been in the industry for a long time. They have a lot of legacy. It's not easy switching it from that to the new age world. But it's no, it's like saying that, I'm running a steam engine, but I want to use all AI into it, right? So it's not easy, but that is something that people need to focus on. So people will have to invest in cybersecurity, not as a core, no, not as a afterthought, IT afterthought. It is not a subset of IT, but as a part of a core function built in by design by using a shift left approach.
You rightly said it is an investment which needs to be made. It's an investment which you cannot ignore. But then, I always wonder, and Murli, you can tell me that why are these hospitals becoming soft targets? And now another thing related to this is, budget is always a constraint, for everyone. And then how come medium-sized hospitals or small-size hospitals, how can they, look into investments in cybersecurity and data protection? If we can throw some light on
I think
that.
that's a great question. See, obviously, we need to understand what is the motive, because eventually, whenever there's an attack, there's always a motive. Without a motive, there is nothing that happens, right? I think one of the critical things that we need to understand is, let's take probably, I'm just taking an analogy here or a comparison here between BFSI and healthcare, right? Now, obviously, all of us know BFSI is very sensitive. All of us are very, very sensitive about our money and other things. So that is there, which is there. But of course, one of the things that has happened is BFSI is a relatively matured industry. While you come to healthcare, there is still a lot of the ecosystem players. I think we talked about it, right from a small, a personal, physician who is running a small shop out of a garage or a small place, all the way up to hospital chains which are there, right? I think that is something that we need to look at. And what is really the motive that is there is basically, first of all, is the high value data, right? The medical data, the medical histories, financial data, identity data, all these things becomes a great asset for the threat actors get a lot of money, because a lot of these things, once they exfiltrate this data, these are all available on the dark web, other sites for huge amount of money. Of course, when I say huge amount of money, actually sometimes it will be pittance when you look at the amount that is there per record, but that is how they really look at it. So therefore, at least today it is estimated that compared to, let's say, a credit card data and all those things, which we are much more sensitive about, because there's a lot of awareness that comes in also, because all of us have bank accounts, or banks keep sending all those awareness notes and other things. But health records can sell at about 10 to 20 times more than a credit card data. So obviously, that's the high value data, which is an incentive for a threat actor to do. Second is the criticality of operations. Now, let's just look at a scenario that you're in a hospital, you have all your records there, your operation, your OT related information, records are all there. This can be life-threatening, right? In a hospital chain, if something goes wrong and your system goes down and you have some operations or critical surgeries which are lined up, automatically this becomes life-threatening. If your systems are locked, encrypted, you don't have access to that data, how do you really look at some of these things? This becomes a huge risk. So therefore, the sense of urgency, and hence, I would say the likelihood of the victim paying ransom is much higher. So from a motive perspective, easier, they are much more gullible to pay ransom compared to some of the other industries. I think that's another reason why this is another area which is there. The third one very clearly is, I think we talked about it, is a lot of legacy outdated infrastructure, right? Most of the hospitals, most of these small things do not really invest in IT and cyber. They've never been really looking at that. Unlike probably the banking sector, which is retail, all of us use, it's much more matured in terms of adoption of digital. So the adoption of digital is certainly lagging. That means you have a lot of outdated infrastructure. People don't value. The question would be, how many of these small and mom pop shops would have IT people who are basically taking care of that infrastructure, patching your systems, right? These are all small things which basically gives the higher threat landscape which can be exploited by the thing. So that is something which is there. Complex, the outdated infrastructure, the complex IT ecosystem. Now, obviously, there's a lot of investments happening around medical IoT, right? Internet of Medical Things is becoming very, very popular. It's all about getting integrated. With digital technologies, all of us can use an Apple Watch and then use it as a Fitbit to send medical data and other things, right? So all of these things means the infrastructure is getting complex and the ecosystem is still not ready to basically switch to a much more secure way of doing things. And last but not the least is, of course, the underinvestment in cybersecurity, right? So underinvestment in cybersecurity means your risk levels are much more higher that can be exploited. Now, coming to the second part of the question, which talks about how can small and medium mid-sized hospitals build strong defenses. I think, see, some of these things is more in the mindset. As I said, it is people, process, technology in the same order of importance. And then, of course, the overall governance. It all starts in the mindset. How do you prioritize? How do you train your staff to ensure that they are taking care of this basic hygiene? Okay, they're not, ensuring that they are taking care of protecting their systems that are there. These are some things which are there. The simple thing when you go back to corporate, you'll say, don't leave your systems open. Do you keep your, systems locked at any time so that nobody can walk in and when you're not there in your seat, I can explore some of your data. Then, of course, there is this entire thing on processes, which means, are you really bringing in your cyber resilience process? And how do you really look at it? If something is hit, how do you protect yourself? You need to focus on some of these areas. Now, this is all process. This has nothing to do with budget. It's just that it's a mindset that you need to protect. Last but not the least, you may not have the most sophisticated tools, but you can still do some of the basic technical controls. Some of the basic technical controls like ensuring that you segment your network. Some of your internet exposed infrastructure should be isolated from some of your internal systems. So how it helps is tomorrow in the worst case, if you still get hit, you will at least be able to limit the damage. Let's keep one thing in mind. Maybe I should have said that when we talked about the first question, is the fact that we should all accept that while we do all things that we will do all things that it takes to ensure that we protect ourselves. The hackers are always going to be intelligent, smart, far more smarter than us. Because we have budget constraints. Most of these attacks which happen are state sponsored. They don't have regulations. So a couple of things, right? Number one is they don't have budget limitations because they're all state sponsored. So they get unlimited of budgets. So you will never be able to compete with them. The second is they are not controlled by regulation. Okay? As industries, we are regulated by various entities and we need to take care of that as well. And all these means they'll always be smarter. So therefore, while you do all these things, the last but most important thing I would say is build cyber resilience. And that is where you need to focus on. I think these are some things which has nothing to do with size. It's just a mindset that is there that even small scale and mid-sized hospitals can really focus their effort on.
Yeah, very true what you said. And to the aspect of you said a BFI sector is matured, right? My my take on that is that because there's already a strong the law is already there from RBI. So which is not in the healthcare sector. The healthcare sector we were expecting DISHA, the data information security for the health sector, which is not yet coming. But I'm still optimistic with the DPDP because DPDP has got the principle of privacy by design, right? So I want you to let us know as to how you can implement privacy by design practically. How can that be enforced?
Sure, sir. But before I answer that question and just add to what you said about Disha, so obviously, while I know there is no regulator like an RBI or a SEBI or even let's say in insurance, you have IRDAI, which are the major regulators that we have in this country. The NABH in their circulars, even the sixth edition that they released earlier in Jan, does articulate some of the best practices that everybody needs to take care. And similarly, you also have the Ayushman Bharat digital mission guidelines. Right? Some of these things are there today. May not be as exhaustive as a regulation, but I'm sure that is something that I'm sure the industry can take inputs from to at least make a start. Right? From a cyber perspective, of course, within cyber, I will say when it comes to specifically privacy, I'm sure DPDP will give a lot more things. Now, when you look at privacy by design, when you really come to this, I think first of all, let me define what I mean by what I understand by privacy by design. I think first and foremost is we need to really understand that when we are really talking about privacy by design, it's all about protection based. Hello? Hello. Sorry, I think I just lost connection. Am I audible?
Yes, yes, you can. Yeah, you are
Sorry,
audible. Continue.
sorry. So I think what I really meant by privacy by design is to ensure that privacy and data protection is embedded into the culture, processes, and all the systems that are there in the organization. So, and not as an afterthought after everything is designed. I think that's the first thing which is that everybody has to note around, right? So when you really look at it, there are a few things that every organization needs to take in. The first thing is consent first architecture. So that whenever you design a system, are you really looking at consent? So if you have to build in when your first interaction happens with the customer, are you building in those consent requirements? Obviously, whether it's a form that is there, if somebody is looking at doing a digital way of doing it, or it is through, let's say, a call that is happening, a verbal call, that voice-based channel, because omni-channel, we need to look at all the channels of communication or interaction that happens between, let's say, the organization and the customer. Look at all your channels and ensure that you are actually building in consent first architecture. Now, of course, it's extremely important. And of course, once the rule comes in, there will be much more clarity, because otherwise the fines are pretty heavy. Because if these consent forms are not clear, articulated, you can have huge amount of fines as per the DPDP which is there. The second is purpose limitation and data minimization. Okay, how do you build in culture, processes, and systems to say that I only collect data that is required for the bare minimum? This is a huge cultural shift more than a systems shift, right? Because the natural tendency is, let's take all the data. It may be worth whatever is required. And now this is going to be a huge shift. Okay? So, it's again a balancing act, right? Because sometimes you can always say, if I collect all the data, I don't have to keep bothering the customer again and again. Right? That's one way to look at it, which is, let's say, for collecting as much data as you want. But the flip side is with DPDP coming in, you need to look at the processes or the entire principle of data minimization. Right? So how do you collect data only for whatever is required? That means, of course, if you need more data, you need to go back and collect more data at a later point of time. But that's a process change that we need to do.
To take
so that is
consent
something
again.
to take consent again, for the additional information that you will need. Right? I think that's something that is there. The third thing is about ensuring that within the organization, you have role-based access. That means between various, I would say, employees that you have within your organization, how do you ensure that access to information is based on what is required and not beyond that? You have to answer the questions what, when, and why. Look at every information access that is there and say what is required to be provided to a particular persona of an individual that is accessing that information. When is it required and why is it required? So you need to entire identity and access management and governance process that exists in the company has to be stepped up significantly with role-based access control. The next thing would be security by default design. What it really means is today, you need to ensure that all your systems are encrypted and protected. Encryption by default on data at rest, which is residing on your storage systems, as well as in transit, that is basically transacting between the end user or any stakeholder and the storage system, needs to be transcripted. Next thing would be around patient empowerment. Okay? Apart from taking consent and ensuring that you are taking care of protection, the Privacy Act also provides for the patient to have can exercise their, I would say, right to do a right to forget if they want. So are you designing a system which allows the patient to anytime interact with the systems that you have built and provide them with that access to exercise their choice should they want to use to say, no, I don't want data to be residing anymore, etc. Right? So that is something that is there. And last but not the least, while we have already looked at from what is required from a hospital and the customer side, all this ecosystem is also dependent on backend suppliers. So you're part of the supply chain. So hospitals always depend on vendors, device providers, etc. So how are you ensuring that you also take care of supply chain related challenges by looking at the backward integration of ensuring that, your vendor ecosystem is all protected. They also follow the same privacy principles that you follow.
So tell me, Murli, what are the technical and organizational steps hospitals must take to ensure security by default while adopting EMR, cloud, telemedicine, or even now AI-driven diagnostics? What do you
Yeah, I
think,
think that,
the steps
yeah,
hospitals should take?
yeah, absolutely. I think that's a great question again. Obviously, I think first of all, again, I keep reiterating this because it's so important. Again, even though we are going to talk about technical controls, I would say that it should not be just an IT concern. Okay? We need to get into that mindset to say cybersecurity is just not an IT concern, but it is a clinical imperative, if you have to put it in the clinical language. It's a clinical imperative that needs to be taken care of. Therefore, to that extent, you need to look at some of the controls, like let's say zero trust architecture. A zero trust architecture ensures that anybody who accesses or any device that accesses any information is not trustworthy. It assumes that it is not trustworthy unless proven trustworthy. Right? So that zero trust architecture is there. I think good thing that is there is, at least my information states that at least amongst the more mature hospitals, 70% of Indian hospitals are at least already adopting some form of zero trust network frameworks. I think that's the information that I have. Okay, so that's something which is good. I think when you look at securing EMR and AI platforms, right, you need to look at platforms that we talked about security by design, ensuring that data at rest, data and motion is all secured. And more importantly, there is adequate audit trails. So you need to ensure that all your system has all the audit trails that is there so that you can go back, should there, and do a forensic analysis, should there be an incident that we need to really investigate. I think one, of course, is unfortunately, if there's an incident and you need to report to the DPB, Data Protection Board, and there is an inquiry, you need to be prepared. But more importantly, it also just builds in that trust that is there for the customers that is there, right? Of course, with AI and other things, this entire thing on explainable AI models, how do you say, how auditable AI models is extremely important. Okay, an interesting thing on Gen AI, right? Gen AI, especially, I think it's something that we need to be really cognizant of, because AI is a very powerful tool, right? In a country which is starved of a ratio where medical professionals compared to the patients are still at a very small level, right? And you need deeper penetration. Technologies like AI can help basically improve the productivity of doctors. But of course, we also need to be cognizant of some of the pitfalls or banes of some of these technologies, right? Gen AI, of course, this whole thing about looking at hallucinations that are there. Because Gen AI, the way it works is it basically doesn't, when you have to create a 1,000-word summary, it basically looks at the previous word and then generates the next word, right? It basically anticipates based on that. So if somewhere in between your report, when you're using AI, okay, somewhere something goes wrong, you can get hallucinated. And that's the risk of AI, right? So how do you ensure that you use these controls effectively? Everybody uses cloud. Now, obviously, now none of us is now not using cloud. Even if you look at just as an email, right? All of us use Gmail or Yahoo Mail, personal email, they're all on cloud. So obviously that means cloud is all pervasive. So how do you really look at controls around that? How do you ensure that these things are taken care? From a telemedicine perspective, of course, thanks to COVID, there has been a spurt of telemedicine. Now, I've been hearing telemedicine at least for the last 15, 20 years. But, thanks to COVID, there has been a real spurt on some of these things, right? Here again, how do you ensure that the end-to-end transfer of data or transmittal of data is completely encrypted? there is session timeout. Some of these technical controls needs to be done. How do you ensure that the patient and providers are authenticated and there is no man in the middle who is actually siphoning off the session and conducting the session and pulling the patient and collecting information? So how do you build a trust in this whole architecture of end-to-end telemedicine safeguards? This is something which is there. How do you, and of course, a lot of these things also would be recorded. Now, how would that recording be stored? A lot of these things become extremely important from a telemedicine perspective. And lastly, from a IoT perspective, today, I think most of the devices that are there are all connected to internet. Right from your scanners, your, all your high-end imaging scanners and other things that is there. You go to any clinic or any diagnostic center or hospital, all of these are all connected. That means you need to ensure that these things are absolutely secure. Ensure that you're patching all your infrastructure across from time to time with the right security patches that the OEMs or the software providers keep providing. I think these are some things which are there that you need to look at. Now, this is there from a technical perspective. And from an organization perspective, we want to really look at it. You need to look at your governance, your third-party risk, your training. Another control that a safeguard that you can use is cyber insurance. How do you leverage cyber insurance to ensure that you're protecting yourself apart from privacy and consent management? So I think these are things that organizations can use to basically protect themselves.
No, in fact, what you said is absolutely right. And as far as AI is concerned, people are under the impression that the DPDP Act does not mention AI, but it mentions algorithms, and explainable algorithms should be there. So in that perspective, I think DPDP is going to monitor, your AI ethics in that sense. One more question that in this same second section is that, what are the challenges while adopting the legacy, aligning the legacy hospital IT infrastructure, right, with the DPDP's expectations for modern, secure data processing framework?
I think two things. I think from a technical perspective, because we have already talked about it, I'm not going to do it again, is also about, a lot of fragmented and outdated systems, right? Which of course is a challenge. As I talked about it, is like saying that I have a steam engine, but I now need to put in AI into that, right? So not going to be easy. So to that extent, this is one of the challenge that is going to be there. Of course, some of these things also mean there is a limited scalability things that is there that needs to be taken care of from a safeguard and integration barriers, which means that if you have to integrate some of your legacy infrastructure with some of the later tools that are there, that's going to be important. From a privacy perspective, I think we talked about a couple of key things, requirements. Today, there are consent management systems available today. There are players who are providing you consent management applications that you can integrate with your existing infrastructure. Of course, you need to, after looking into some of the technical challenges, data minimization and retention conflicts which are there. These are something that needs to be taken up, which is there. The security protocols. Now, again, all these systems are integrated with each other. So how do you really ensure that some of the APIs that are there or any other integration protocols that you may use is something which is there. Now, a lot of these legacy applications, I'm using a technical jargon here, is lack implementation of, let's say, TLS encryption or a multi-factor authentication, because just going on password may not be good enough, right? Today, because passwords can easily be compromised. So these are technical controls which is there. And last but not the least is I keep telling about governance and other things. Obviously, challenges again from our smaller companies are always around having a dedicated DPO and other things. They may not have the wherewithal, but then there are possibilities. That's where they can appoint a consulting DPO. Today, that's an option that they have, where organizations can look at a fractional DPO or fractional CISO, etc., which can help in basically alleviating some of these problems. If we really look at it, I think if I have to sum it up, I think in the short term, I would think a couple of things. One is to do a data audit, look at all your sensitive data, do a complete data discovery, ensure that you do it. We call it as a data discovery and a data flow diagram that you create so that you very clearly understand how your data is moving. Implement your access controls and encryption, which are more technical controls, right? And then, of course, look at all the integration challenges and train your people. I think these are something that is there. Long-term strategy obviously could be use cloud in some of these things, because cloud is not going to be easy, because that is something that, with built-in DPDP controls, that's a decision that can help alleviating some of these things and transitioning some of the risks that are there, which is there. And of course, we'll collaborate with the cybersecurity ecosystem to ensure that, we are taking care of protection proactively.
So now that we are expecting the DPDP rules to be notified, I'm coming to my third and the last section, which I mentioned. This is regarding incident and the breach notifications. So what do you think? What do you think? But if you can let everyone know the timelines and the expectations, around a breach, when there's a breach of data, what are the timelines for the notification?
I think so. Obviously we'll wait for the detailed rules to come. But the way I look at it is, at this point of time, is what I call it as a 72-hour rule. I think what you really need to do is ensure is that, within this time, as soon as you determine that there is a breach that has happened, you need to ensure that all data fiduciaries, whether it's hospitals, clinics, lab, etc., must notify the Data Protection Board, DPB, which is there, and also all the data principals, people who are affected. That is something which is there. That's a requirement that is there. So that is something that needs to be taken care of, right? But yeah, some of the other things from a healthcare organization expectation would be immediate escalation, internal escalation, right? How is it that you can, if you detect a breach that is happening, how do you quickly internally escalate and take adequate controls so that you minimize the damage? Obviously, we talked about some of the controls like network segmentation, okay, and some of those things which are there, which can help you do that. But how do you ensure that you jump in, you isolate? For example, if you are hit by a ransomware on a particular system and you detect it, your EDRs and other tools detects it, how you quickly go and isolate that system so that you at least eliminate lateral movement of that impacting other systems, that magnifying the potential impact that could be there. The second is obviously quickly doing a materiality assessment. Right? Once you know what is there and once you've contained your breach, you need to do a material assessment of what is the impact of that, right? Is it just I know what is the risk, what is there, what sort of data is gone? Is it just some basic information of, let's say, credential information and user ID, password, or is it even gone to the extent of, let's say, data related to medical records or your clinical diagnostic reports, etc. So that is something. So a profiling needs to be done of what is it, the material breach that has happened there. The third would obviously is reporting. You need to report to the DPB. Of course, certain also has certain requirements, but let's see how these rules come up so that there is some sort of a unified reporting that happens. Because today there is also a need to report to multiple agencies when something is happening. And I think so. If you look at it, the best practice, I would say, very clearly is every organization needs to prepare what I call as a breach response playbook. Okay. Many of us may be aware of what we do for business continuity, right? We all have business continuity plans. So we do a business impact analysis. Similarly, do a privacy impact analysis under various type of threats that you have. And once you have identified that, you start looking at how are you going to respond. Create those processes within the organization, train your staff to take care of that. And of course, keep doing those exercises. All of us, I'm sure, are party to fire drills that happen in our buildings, right? Once in 6 months, we are all asked to evacuate the building for fire drills as part of BCP testing and other things. So similarly for privacy, you need to keep doing some sort of internal simulation testing so that you ensure that the organization is ever prepared and it is just not in process stored somewhere in the directory that is there. I think that's what I feel is important element.
Yeah, thanks. Because the draft DPDP rules say that if there is a data breach, you have to immediately notify and then give a detailed report within 72 hours. But let's see how the rules frame out. And as you rightly said, if there's a format of reporting, it makes sense, because there are multiple authorities where you could be reporting, because there is BFSI, you have to report even to RBI. There are, as an example. Thanks, Murli. Just one last question. I do not know whether I think we've already crossed the timeline.
Yeah, I know.
But in case there are any, should I throw it out to the audience, the opportunity for them to, if anyone wants to ask any questions?
Yeah, I think that may be good. I think let's do that maybe.
Any questions from the audience? You can just unmute yourself and just ask Murli. Yes, Salman, please go ahead. Salman, you're on mute. Yeah.
Your mic is allowed.
Salman, you're on mute.
Yeah, sorry, I was talking on mute. So I was thanking Murli sir for taking this up, taking this session, and now I have few pointers which I wanted to discuss. One is that I have gone through the DPDP rules in detail. So, but according to you, Murli sir, what are the major differences if I compare that with GDPR? To me, apart from one or two subjective changes, I cannot see many changes. If or I'm talking from implementation's perspective. So if GDPR is implemented in my organization, what are the additional controls which I need to take care when we want to implement DPDP Act also? And secondly, in the last section, you have talked about the drills with regards to data privacy. So when we say drills with regards to data privacy, are we talking about call tree drill type of activity, or what kind of activity we can expect or conduct when we are talking about data privacy drills? So these are two of my questions which I wanted to ask you.
Sure, I think, okay, let me try and do this. I think there are a few differences between GDPR and DPDP. While broadly, I would still assume that, it covers most of the things. I mean, if you look at GDPR, it basically looks at a much more broader perspective of processing of any personal data of a EU individuals. While of course DPDP focuses specifically on digital personal protection, data protection. I think that is something that we need to look at it from a perspective what is there, right? From a perspective of from a consent perspective, okay, DPDP is a little bit more stricter, right? It has got stricter rules, which also talks about the need to specify processing purposes. That is really there much beyond what GDPR requires. I think that is something which is there, From a grievance redressal perspective, if you really look at it, the DPDP again provides a mandate for a specific step-by-step process, but while GDPR does not give a very specific process and other things. Now, these are something which are there. Of course, I'm not talking about the financial penalties, which are obviously different, which is there between each of these things. Now, looking at your sector, basically their basic controls will still remain the same. I think except for these finer aspects of it, which you need to take care, especially from your process side and training side. A lot of the technical controls will predominantly remain the same. I think that is something that is there. From your second question perspective, what I really meant is to ensure that you simulate conditions, just create a table now. You again do a tabletop testing or something. You say, let's say, just simulate a condition that, a system has been hit by ransomware. Now, this is a notice that an alert just comes in. Now you quickly say how is it the organization is ready to react to it, right? Like what do you do in a typical business continuity plan testing? What you do is create a scenario where you say, okay, this particular, let's say the site is not available. Okay? Let's say there's a fire in your building. Then what you do is really, start looking at your fire drills, where you start moving, evacuating people, and of course your floor wardens kick in to really look at what is it that they need to do, their accountability and other things, right? Because otherwise what happens is you have a very good, nice document process in paper where you have identified individuals, you have identified their roles should such an incident happen, but they are not ready. They are not in touch with their roles when unfortunately something happens, because this is not something that keeps happening every day. And of course, we all keep our fingers crossed and hope that this doesn't happen every day, right? So it basically tests your processes and other things as well, right? So just let's say take simulate an attack. You say that your primary server is hit by ransomware, and your entire server is locked. Now test out what happens which is there. Now create a scenario to say, if that has happened, first of all, your process, I'm giving a typical workflow, right? I'm not saying it is something that you need to do, but let's say a typical workflow would be is your tech team jumping in and ensuring that you're preventing lateral damage. You're just going there, going onto your network controls, isolating that server out from the system so that it doesn't traverse laterally to other elements of your segments of your network. That's the first step. Will that happen? Now, once that happens, are you looking at two parts, right? One, obviously, again, there are multiple parts here, right? One is you do an impact analysis of finding out what is the issue that is there, materiality which is there, and other things which we talked about, because you also have to start looking at another channel which is communication. But the third angle is about business continuity. Now, what will you do to business continuity? You'll start looking at, okay, how are my backups? Okay, do I have my backup? How do I restore my backup so that I get my business back to normalcy? Because let's say if that particular server is down, and you had that's critical records, now you need to recover data.
Yeah.
You need to restore data. So again, if you look at it, you do that impact analysis, you look at recovery time, you design your systems to recover data back so that you take care of restoration of business. So I think this is what I meant when I say you start looking at your drills that are there as part of your privacy, like you do for business continuity.
Thanks, Murli. No, thanks, Murli. I mean, we don't have the time now to continue. I mean, it's such a subject where, even a day will not be enough. But in case any of the members of the audience have any questions, you can always send an email to us to 14 degree or, on the LinkedIn page of 14 degree Azimuth Advisory. The bottom line, Murli, is that, you have to respect data privacy. In India, it's a fundamental right. And it's not just the fine of 100, 250 crores. It is the reputational risk, the business continuity risk. And therefore, if you don't have the in-house capacity, please reach out to consultants. We are there, 14 degree Azimuth Advisory. With that, I thank you all for giving your time and staying with us. There are 26 participants even till the end, although we have crossed the timeline, which is very great. And stay tuned in for our next Fireside Chat. We'll keep you informed in due course. Thank you, everyone. Bye bye.
Thank you, everybody.
Thank you.